40-year-old Randy Gaddy looks to be the picture of health, but a silent killer lurks inside his body. Randy has high blood pressure, also known as hypertension.
I've always known to periodically check my blood pressure, and I was actually in the grocery store one day using one of the automated where all you have to do is stick your arm in there and it'll give you your pressure. I always had it done. It just so happened that one time I had done it and it looked to be high.
A visit to the doctor's office confirmed that Randy indeed had high blood pressure. Left untreated, it could lead to a stroke or a heart attack. According to the American Heart Association, heart disease is the #1 killer among men. Stroke is the 3rd biggest killer in the U.S. and a major cause of disability. And the American Cancer Society says that other than skin cancer, colorectal cancer is the 3rd most common cancer found in men and women in this country.
And that's it.
Thanks. Doctors say that when a man turns 40, he should undergo 3 basic tests: a carotid ultrasound, a stress test, and a colonoscopy. Those tests can be used to detect whether you're on a collision course with heart disease, stroke, or colon cancer. So, why aren't men undergoing these tests to determine if they're at risk?
Mainly because it's time. They don't want to spend the time to have it done. These tests can be done if we want to on a regular basis. They can be lined up ahead of time, and you can do all of these tests, including a complete physical exam, and be out of there by noon. It can be done in half a day, and in half a day once a year is not too much to ask.
The stress test involves patients getting on a treadmill while medical personnel monitor their heart rate.
What we do is walk the patient, and during that time that they're walking and their heart rate is going faster and faster, if the electrocardiogram changes and certain signs show on it that shows the heart is not getting enough blood, then we know that that patient is predisposed to having a heart attack.
Dr. Crosby describes a stroke as one of the most devastating things that can happen to a person. A stroke occurs when a blood clot blocks an artery or a blood vessel breaks, interrupting blood flow to an area of the brain. When either of these things happens, brain cells begin to die, and the victim may lose control of parts of his body or his ability to communicate. A carotid ultrasound can help determine if you're headed for a stroke.
The best thing we can do is listen. And if you listen to the neck, you can hear that noise as blood goes through a tightened artery. It makes a different sound, and so the doctor can hear that.
It's also important to conduct an abdominal ultrasound to check the aorta, the main artery that comes out of the heart and splits off to carry blood to both legs. The 3rd major test you should undergo is a colonoscopy. This allows the doctor to look into the large intestine for any abnormalities.
If we find a polyp in that area, and most polyps in the colon are precancerous. So if you can remove that small polyp, and then you say, okay, that we've prevented probably a possibility of a cancer.
Despite the information that these 3 tests, along with a routine physical exam, can provide, some men don't want to go to the doctor because of a fear of what the test might reveal.
Well, that's hard to say, dummy, but that's really what it means. You're just not thinking of your family and your own life. You need to say, this is something I can do so that I will live longer, more productively, and a better life. So I think that's just up to the patient. They've got to do it.
Randy is determined not to become a statistic. His doctor put him on medication to control his high blood pressure. Randy also tries to watch what he eats and keeps tabs on his sodium intake.
That makes me feel a lot better. Like I say, I come from a family that has hypertension, and like I say, and a mother, honestly, that has had a stroke, and I honestly believe if they would have gotten regular physical checkups, then it's something that could have been prevented, honestly. So I'm happy to the fact that I do have regular checkups, and now with my doctor's help and medication, like I say, we're able to control it, treat it.
Remember, it's never too early to start improving your health, and you can start by scheduling your 3 tests the next time you're slated to undergo a physical. For Smart Medicine, I'm Rod Starnes.
Joining me now is the Medical Director of the Executive Health and Wellness Program, Dr. Thomas Meriwether. Dr. Meriwether, thanks so much for joining us.
My pleasure.
Now, those 3 tests we just saw are just the beginning.
Well, they're an integral part. The colonoscopy is included as part of the executive health evaluation. The exercise stress test is included routinely. The carotid ultrasound, however, is limited to those patients whom, when I examine them, if they have what we call a bruit or a sound in their neck made by obstruction to blood flow.
What other tests are you doing?
Well, we do a complete gamut of studies with routine blood tests, hemoglobin, hematocrit, white count, red count, platelet count. Then we get into the chemistries and the urinalysis, and we do some more sophisticated studies with doing lipid profiles where we take cholesterol and break it down into the good cholesterol, the bad cholesterol, the triglycerides, and so forth. We do PSA tests in men. We do hemoglobin A1C study, which is a study to screen for diabetes, which tells us what the blood sugar has averaged over the last 2 or 3 weeks. It's not just a single point in time test. It tells us what the blood sugar has averaged for a period of time.
Tell me why this is so important.
I think it's important because you are trying to find out if that individual, either male or female, is in indeed good health. And should they begin to anticipate problems and try to make lifestyle adjustments, decisions about their life and how they're going to live it to stay out of trouble.
How can viewers learn more about these programs?
These programs are actually, my executive health program is at Baptist Collierville. And there is a number and a lady out there who will take anyone's call, and either I or Dr. Glenn Crosby will be in contact with them to discuss what they want, what their needs are.
Dr. Meriwether, thanks so much for joining us.
Appreciate you very much.